I liked him from the start. I immediately thought I was like, wow, like I got paired with a good LFME preceptor. I got really lucky. I'm Cassandra. I'm a first-year medical student here at McGill University.
The fears that you have going into seeing the patients and trying to impress your supervisor, and like that was the most challenging part in the beginning. And after that I was like, oh, he's not scary, we're okay. My name is Francesca. I am an MD PhD student here at McGill University.
I think this experience really showed me that I had no idea what family medicine was. Working with Dr. DaCosta just fully changed my view on it.
I learned that as a family doctor, there's really so much you can do. And I think that was the incredible part of it. On top of the fact that you have this longitudinal part to it where you're getting to know your patients, which I also loved. I absolutely loved that you knew them so well.
They love you guys.
And
by heart, by name. Whenever someone walks in, he knows exactly who they are, like who their grandparents are. Like that's amazing to me.
you see a lot of mental health challenges in the family medicine kind of clinic setting. And we were seeing a lot of adolescents, and I think there were a couple instances where, you know, you're faced with very challenging situations and how to manage that.
I've heard from a lot of my friends that they didn't know that, like, for example, like family doctors worked in emergency and they worked in like obstetrics and like gynecology, all while being family doctors.
It's the foundation for everything, and you have to know about so much, about everything.
Well, I'm just a family doc, or I'm just a GP, which is what it used to be called in the old days, right? It is absolutely not that. Because if you do it correctly, it should be where you've actually saved the system a lot of money and saved the patient a lot of adversity.